Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hey there, welcome to this week's episode. Great to have you here. As always, thank you for joining me. Today we are continuing our journey down the face throughout the various muscles that we can use Botox for or neuromodulator for in order to help with wrinkles and various other issues that we may want to deal with on the face. If you haven't had a chance to go back and listen to the previous couple of episodes, then I encourage you to do so. I talk a little bit about the frontalis, that's the muscle along the forehead. We talk about the corrugators, the muscles that cause the frown lines in between your eyebrows. We talk about the procerus, which is the muscle between your eyebrows that causes horizontal lines along the bridge of the nose. We also talk about the orbicularis oculi muscles, which are the muscles around your eyes. Today, we have a special muscle that we're talking about, and it's a mouthful. The actual name of the muscle is levator labii superioris aliqui nasi. And there's various different pronunciations of that depending on who you ask. But it is often referred to as the LLSAN because that is the abbreviation, LLSAN. And so if I just refer to LLSAN, I'm referring to levator labii superioris aliqui nasi. Now, what is this mouthful of a muscle? Well, this muscle is all about controlling your upper lip and to a certain degree, the ability for you to flare your nostrils. As I've done with the previous few episodes, I want to talk a little bit about the anatomy of this muscle, the function of the muscle, what it does, and then, of course, when we inject some neuromodulator into this muscle, what does that help with? What does that do? What are we trying to accomplish? So let's get right into it. The LLSAN muscle is a pair of muscles that runs down along both sides of the nose. It starts up along the bone, just on either side of the nose, and then it runs down almost vertically, but flares out a little bit. You can imagine it almost following the contour of the nose as it flares out a little bit, and then it inserts into the skin of the upper lip, as well as to a little bit along the cartilage of the nose itself. What does this muscle do? Well, if it starts higher up in the bone near the nasal bridge on either side and then inserts into the skin of the upper lip, when you contract that muscle, it pulls the upper lip up. That's what a muscle does, right? When it contracts, it gets smaller. And one end of it, the upper end of it, is fixed to bone, and the bottom end of it is inserting into the upper lip. And so one of those sides has to move when you're contracting a muscle, and it happens to be the lip in this case. So that pulls the lip up. Why is this important? Well, there is something that is known as a gummy smile. And this is essentially the most common reason that we are treating this muscle. A gummy smile is essentially a smile where one smiles, and when they smile, that upper lip is pulled up higher than the average person. And what that means is that it exposes the upper gums to the world when that person is smiling. So most people, and of course there's some variability in here, so keep that in mind, but I will say that a lot of people, when they smile, you see a portion of their upper teeth, but you don't see a lot of the gums. In some cases, when people smile, the upper lip pulls up a little bit higher than average, and as a result, you see the gums, hence the term gummy smile. This is an appearance that some people would prefer not to have, and the interesting thing is you can treat this with neuromodulator. Again, neuromodulators include a number of different brands, Botox, Nuceiva, Dysport, Xeomin, and the way they work are by relaxing the muscle, so the muscle doesn't contract as much. So what does that mean? Well, when the LLSAN muscle contracts, as I said, it pulls the upper lip up. When you inject neuromodulator, and now that muscle cannot contract as much or as strongly, it doesn't pull that muscle up as much. And hence, you get less of that gummy smile. The upper lip stays a little bit lower down, and you don't see those gums. Now, there is obviously an art to this as well, knowing how much to inject, where to inject it, injecting the neuromodulator to the right depth so it gets to the muscle itself. And this is something that an experienced injector would be able to assess. So This is not as common as, for example, treating the forehead, the frown lines, the crow's feet around the eyes, and that sort of thing. But it is a very nice treatment for those people that do have a little bit more of a gummy smile than they would prefer to have. It's a very, very simple procedure. It is essentially one tiny injection just to the side of the nose to cover the left LLSAN, and one more tiny injection to the other side of the nose to cover the right LLSAN. And after a couple of days, as with all neuromodulator treatments, it starts to kick in, with the full effect being noticeable within about 10 days or so. That's it. This does wear off after a little while, after about 3 to 4 months, and that is when we would suggest to have the treatment done again if this is something that you enjoy the look of. So that's the little podcast today on the LLSAN. As I mentioned, it's a bit of a mouthful, but it's a really nice treatment, very simple treatment, 2 tiny injections and it's done. And if this is something that you were not aware of and you might be interested in having a gummy smile treated, then definitely get in touch with me. Again, I'm at antiagingvancouver.com. I'm on Instagram at Dr. Teri Fisher, DrTerifisher, or on my website at drterifisher.com. Thanks for tuning in this week. Once again, please go back and listen to the other previous couple of episodes. You'll learn lots about the different muscles that we can treat with neuromodulator, and we will continue our journey down the face next week. Have a wonderful week. Be well, and I'll talk to you soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.